by Chemtai of Citizen regarding the statement presented to Parliament, where you say KEMRI is claiming certain sum of money. I think it's actually 790 million and not 900 and something. I've seen that report. And how does this affect our testing? I don't want to delve into the matter that is in the report, but I will respond to the question as to whether it is affecting our testing or not. As we have said, our testing program encompasses several testing centers. The National Influenza Center within the National Public Health Laboratory is one of those. KEMRI Laboratories is another one. And we have several other testing facilities within our national referral hospitals, within our research institutions that are spread over the country, and within the laboratories of our collaborators who are working with us across the country. And for most of these laboratories, for the COVID-19 response, the government has developed a resource plan for not only testing, but for all the requirements that we need for the COVID response. The so-called COVID response contingency plan. And in this plan, we have quantified and earmarked resources that will go to various activities. Since we're talking about testing here, I can tell you that we have earmarked resources, we have quantified, and we know what are the resources we require for testing. We have been able to get resources for testing through the resources that the country has mobilized so far. And if you will note, you will see that our testing levels have continued to increase despite the constraints that I have mentioned repeatedly in terms of getting the reagents and other products. So what I want to say at this point is that our testing ability is not going to be constrained because of lack of resources to buy the reagents. Rather, it will be a lack of being able to access the reagents. I am, however, happy to announce to you that yesterday we received a consignment of 8,000 tests for one of the instruments that we use. And today we're expecting another almost 18,000 tests for that. And we have several of these tests that we have now been assured are in the pipeline that we shall receive another consignment by the end of this month, and we shall receive another consignment during the month of July. So I think in terms of the reagents for testing in the lab, at this point in time, we have sufficient reagents to be able to do the testing and the targeted testing that we want to do. This now brings me also to answer the last question that was in Kiswahili.